Since the outbreak of the COVID-19 pandemic, healthcare systems across most cities in the world have found themselves at the brink of collapse. Nigeria, Africa's most populous nation, was also hard hit, exposing the weakness of its healthcare system. As the nation approaches its 22nd Democracy Day, we explore the main factors affecting the effectiveness of the country's rather weak and fragile health system since 2015. Health correspondent Kemi Balogun also filed this report.
With a population of approximately 200 million people, occupying 774 local governments, Nigeria, Africa's commercial hub, sits on an almost non-existent healthcare structure. The COVID-19 pandemic has brought to light the hidden lapses in many healthcare systems across the globe, and most of them almost collapsed, especially when the second wave of the pandemic hit through cities, crippling them. Nigeria wasn't hit as hard from both waves, but its health system was plagued by strikes, protests, and drained resources. At the start of it, the administration of President Buhari had put at the fore of its healthcare response the need to put primary health care at the top of the pyramid for healthcare. This would be done through the revamping of healthcare facilities across all wards of the Federation, amounting to about 10,000 facilities. But has this actually made a difference?
So we appreciate that.
Elizabeth Itodo lives in this community called Paduma, and for the past 15 years, there has been no primary healthcare center at the community.
The road is not all that good, and we have some chemists around that women give birth. Sometimes, for the process of going to the hospital, it will too far for them to go to the hospital. They will decide to give birth at that chemist. Sometimes they will decide to labor, and they will lose the child.
There is a long list of factors that continue to weaken the health system in Nigeria, with funding being at the top of the list. Nigeria's budget allocates less than 10% instead of 15% to the sector, which has a budget of 547 billion. This is about 7% of the 2021 budget total of 13.08 trillion naira.
The healthcare in Nigeria is not where we need to be. From 2001 Abuja Declaration, we agreed we're going to give 15% of our budget into healthcare. We still haven't even reached half of that. And so that tells you that we're not where we're supposed to be.
Apart from the lack of political will, inability to implement good policies that could move the health system forward is also another challenge facing the sector. Hawa Abbas, who works with communities in healthcare, further stresses that the remedy lies in shifting focus from the federal level down to the state and local governments.
Some of these policies can be put in place, and they can actually be monitored to ensure that, from beginning to end, it actually works, and then we can look at what didn't work and what did work. But political will is one of our biggest issues. I mean, every state and every citizen should start taking responsibility for themselves and for their states. If you're a citizen of a particular state and your healthcare is bad, the education system is bad, then you need to blame your state representatives and your governors as well.
The National Health Insurance Scheme has been highlighted severally as one way out of the jam that comes from the lack of access to healthcare for Nigerians. But the country can only account for about 11% of Nigerians on the scheme. Health insurance coverage for Nigerians is still abysmal. Recent findings from a poll revealed that as many as 89% of the population pay for healthcare services out of pocket. 9% claim they have some form of health insurance, and 78% are not on the scheme but are willing to be on it. Kemi Balogun, TVC News, Abuja.